Welcome back to Your Health television program. I'm Dr. David Morwood. I am a board-certified plastic surgeon, and I'm delighted that you could join me for this first segment. During this first segment, I'm going to talk about cosmetic treatments, mini procedures in the office, minimally invasive or non-procedures in the office that we can offer to people who are interested in improving their appearance, particularly of the face. However, they are not at a good point to have downtime or don't want a dramatic change, but just want a little sort of mini procedure or a little buffing up procedure to improve their appearance. So I think there are three categories that I'd like to address as I discuss cosmetic treatments during this first segment. Number one, skincare. Number two will be Botox. Number three will be fillers or volumizers. And if we have time, I'll briefly address mini lifts and mini surgical procedures, mini procedures that we can do in the office. So to start, skincare. Number one, when I see people in the office who are interested in minimally invasive or non-invasive procedures, I certainly like to look at their skin. To begin, anyone who lives in California probably enjoys the outdoors. Of course, we love the sun, but we know it's not great for our skin. We love being outdoors, but we're often exposed to the sea air, which has salt in it, and the wind, etc. In combination, the wind and salt and sun, particularly, can really be damaging to the skin and its appearance. Even though it feels great to lay out in the sun, the number one lesson that I try to teach people is to avoid direct sun on their skin. Not only can it lead to a less youthful appearance and a more wrinkled, sort of dried out appearance, it can also lead to more skin cancers, and I think that's important. So number one, when we talk about healthy skin and skincare, I try to teach people to avoid the sun. Number two, we need to learn how to properly cleanse the skin. Some people have oily skin, some people have dry skin, and some people have combination of these types of skin on their face. And so a dermatologist or a plastic surgeon or an esthetician or a facialist can teach you how to properly cleanse your skin. I think that's very important. Now, number three in our list is exfoliation. As many of you know, the very top layer of skin is not living. The stratum corneum is almost like a keratin layer. It's like hair or nails. It's not alive, but it does serve as an important barrier and protective element. However, for some people, that very superficial keratin or stratum corneum layer can be somewhat thick, and it leaves the skin appearing dull, perhaps dry, sometimes flaky. And what we're really desiring is a brighter sheen, a more attractive finish to the skin. So to exfoliate is a process where we encourage that top layer to come off, and we encourage the very top layer of the epidermis to come off. And that in itself can encourage new baby cells and turn on that factory down in the germinal matrix and basal cell layer to make new baby cells, which of course is third on the list. We want to encourage regeneration. There are actually treatments that we can apply topically and with other types of procedures that we can administer in the office to encourage new baby cells to be manufactured and to help increase the youthful appearance of the skin, and also probably to improve function. Please keep in mind it takes about 30 days for a new baby cell that's manufactured and born, manufactured by the body down in the germinal matrix and basal cell to come to the top where it's visible. So at times I hear people say, you know, I've tried skincare for 2 weeks and I've done this and I've used this cream for 2 weeks and I barely see a difference, or I don't see a difference. Well, you haven't even given the body time, you haven't even given yourself time enough those first 30 days for the top layer to be able to see the new baby cells. And of course, that's just one shedding or one layer is 30 days. Imagine if you give yourself time and use products or proper skincare and undergo facials, etc. for 6 months, 12 months, or greater. You should see a dramatic appearance, or certainly a marked improvement in the appearance of the skin. So I'm a big believer in skincare. So we mentioned avoiding the sun, properly cleanse, exfoliate, restoration or restoring, And of course, it's important to learn how to moisturize the skin. Moisture of the skin is vital. It's really important, particularly for people who will undergo some sort of exfoliation process, because as the skin exfoliates and you are on a product such as Retin A or something, glycolics, or undergo mini peels, you want to make sure that your skin stays moist. Oftentimes I will see people in my office and they are concerned about their wrinkles or what they perceive as wrinkles when it's actually fine, crepey skin, particularly around the eyes, sometimes around the mouth. And the issue is that the skin is dry. So simply by learning how to properly moisturize without blocking pores, that can be an important step towards skin health. And finally, second only to avoiding the sun, no smoking. Most people are familiar with antioxidants. Well, the converse of that word, antioxidant, is oxidant, almost like rusting. Each puff of smoke from a cigarette has many thousands of oxidants that can damage tiny blood vessels and, of course, play havoc with the health of the skin. So second only to avoiding the sun, I really encourage my patients who want pretty, attractive, vibrant-looking skin to not smoke at all. And that goes for secondhand smoke. So again, avoiding sun, no smoking, of course, properly cleanse, exfoliate, we've talked about that, restoration and regeneration, encouraging the germinal matrix and that layer that makes new baby cells, and of course to moisturize. Now, in terms of having a product line or applying products to the skin, I think it's something that everyone should do. It's like caring for your teeth. Most people get into a routine of flossing and brushing. I think caring for your skin is just as important. Now, seeing an esthetician and getting a skin evaluation is very important. I think facials can help, and you can have a custom designed program for you and your skin. And mini peels can punctuate the skincare process. Mini peels are a way to, as I said, punctuate and accentuate the progress that we can make towards skin health and skin restoration. These are things like mini peels in the office with glycolics or kojic acid, etc., all the way up to something more aggressive like a TCA peel. TCA is something that I think can be very helpful for many patients, trichloroacetic acid. The weaker TCA peels we can do in the office. For stronger TCA peels or deeper TCA peels, we can do in the office under a block. In other words, I can make the face numb with an injection. Or some people prefer to do this in the operating room under sedation or even under a general anesthetic. So that's an introduction to skincare. As I said, there are about 6 steps ranging from avoiding the sun to no smoking, proper cleansing, exfoliation, regenerating, moisturizing, etc. This is very important. And I think a consultation with a plastic surgeon, dermatologist, skincare expert, esthetician, I think that's really helpful and vital. And just like seeing the dentist, everyone needs to take care of their skin the same way everyone needs to take care of their teeth. Now, number 2 on the scale, when we talk about non-invasive or minimally invasive, Botox. And there's a related product called Dysport. Many of you have heard of that. The active ingredient, the active molecule is the same, but the carrier molecule is different. Now, Botox is a muscle relaxant. It was first used, I can estimate 30 or 35 years ago, in children with muscle imbalances of the eyeball that led to things like esotropia or cross-eyed or exotropia, wall-eyed appearance. Micro amount of that toxin can be injected or introduced into the extraocular muscle to help rebalance the eyeball and eye motion. So how can we use that to our advantage for facial appearance? For example, the so-called 1s and 11s and 111s that the company likes to refer to, think of an accordion. The muscles underneath the skin are contracting, which act like an accordion. I think my producer, Jim Vosen, is very familiar with accordion playing. Think of the accordion as it is squeezed. The overlying skin is sort of pinched or compressed. And that's essentially what a furrow is in the glabellar area here between the eyebrows, and which can lead to a wrinkle. A wrinkle essentially starts out with muscular activity going back and forth hundreds of thousands of times. Think of something like a piece of paper and you fold it and stretch it and fold it and fold it and stretch it, etc. After a while, even though you stretch it out again, there will still be a permanent crease in that paper. That's essentially what a wrinkle or ritid is. So how does Botox work? Botox is a muscle relaxant that can minimize the muscle contraction underneath the skin so a furrow or wrinkle will dramatically soften. It's different than a filler that we will address in a few moments, but a filler is a muscle relaxant. I first used Botox about 25 years ago when I was a fellow at Children's Hospital in Los Angeles. I think it's a safe medication. They call it a cosmetic or a cosmetic medicine. It's safe. I believe I like it very much in the upper third of the face, around the eyes. I'm very judicious in the middle third and around the mouth. Very careful and very conservative. But I think it's excellent around the periorbital or eyes. We can also do some conservative shaping, particularly of the eyebrows with Botox. How does that work? Well, we know for the eyebrows, there are muscles that depress the brow. For example, the corrugator, the procerus, and the bicularis oculi. And there's one main muscle that elevates the brow. That's the frontalis. I know where those muscles are. I've seen them thousands of times. When we selectively make the depressors relax, that allows the elevators to take over, and we can give the brow a conservative reshaping, particularly in the lateral third of the brow. When I say lateral, I mean closest to the ear as opposed to the medial near the nose. We can selectively elevate the lateral brow to give a more youthful, vibrant appearance. If you look in any of the glamour magazines, all the models, particularly the female models, have a peak of the brow at the lateral 1/3, and then the brow goes horizontal or sometimes comes down. So it's not as aggressive or dramatic as a surgical lift, but certainly we can do conservative shaping of certain facial structures with Botox. Now, what about volume restoration or volume restorers like fillers or fat? I mentioned that Botox will make muscles relax underneath the skin, thereby softening a furrow or fine lines. Well, what if a person has static lines or static furrows? There's a difference between a dynamic furrow and a static furrow. When you have a dynamic furrow or line, that is present only with facial animation, only with moving. When someone is in repose or their face is relaxed and they still have a line or furrow, that may be an indication for a filler or a volumizer, such as a filler or fat. Fillers most of you have heard about: collagen, Juvederm, Restylane, Radiesse. There's a new one called Bellaterra that we can use in the more superficial layers. What that does is restore volume. My favorite way, or my favorite indication for fillers, is to add volume in the deeper portions of the face. For example, on the cheekbones. Some people notice, and we all, as we mature, lose fat in our face and in our hands as we mature, and we gain weight in our trunk. It's sort of a bad joke played on us as we mature. Again, as we mature, we lose fat in our face, we lose fat in our hands, and we gain fat in our trunk. And hence, as we lose volume in the face, it allows gravity to act more on the face and act as a depressor, and we can actually see mid-facial descent. The brows can come down, we can have more prominent jowls, etc. And that issue is more of a volume loss as opposed to growing more skin or the skin losing its resilience or becoming stretched out. So to revolumize is when we take a filler off the shelf. It comes in a syringe, it's sterile, and we use it to inject. I like it for augmenting the cheekbones. I can bring the chin forward a little bit, conservative amounts. I can accent the mandible angle. Many of the models, as you could flip through any glamour magazine, both the men and women have angular, well-defined faces. We don't want to have a flat or undefined face. So fillers can help with that, and it's done right in the office. Now, the difference between fat grafting and fillers. What fat grafting is when we do some conservative liposuction, we spin the fat down, centrifuge it, cleanse it, purify it, etc. And then we re-inject it into that same person. For example, we can do conservative liposuction from the abdomen. We can spin that fat down, keep it clean, purify it, concentrate it, and we can re-inject it into the cheeks over the malar areas, the chin, fill in the nasolabial folds, etc. That can be very effective for revolumizing, keeping in mind that as we mature, we lose fat in our face and our hands and gain weight in our trunk. There are certain fat cells that seem to be sort of resistant to that aging process. So if we can harvest those fat cells, transpose them to the face or the hands, that can be very valuable. Now, I do want to mention stem cells. It's true that about 1 out of every 176 cells that's grafted or transposed to the face is a stem cell. We can also bring up some estrogen receptors, etc., because estrogen receptors are involved with the adipocyte or the fat cell. So it's true that fat grafting can actually have a rejuvenative effect on the overlying skin, and more of us are noticing that. I think it can be great for augmenting the cheekbones, bringing the chin forward, etc. I think it's fair for furrows and to minimize lines. However, the best thing for wrinkles, though, is to resurface the skin. I think there's a definite difference between surgery, which is rearranging tissue and moving tissue, restoring volume, etc., and oftentimes we do fat grafting and or fillers and treating the skin. As I talked about before, TCA peels, laser skin care, that treats the texture of the skin. Things like dyspigmentation, dark patches, fine lines, crepey skin, etc. So we talked about skin care, I talked about Botox, I talked about volumizing agents such as fillers and fat, and I should mention that fat grafting is more or less a surgical procedure. It's a procedure, can be done in the office or it can be done at the surgery center or even the hospital. It can be done under local anesthesia or a block anesthetic in the office. And we have lots of choices, so we can custom design a choice for you. Now, very briefly, I would like to mention mini lifts. Oftentimes people come into the office and they just want an isolated area done. For example, just the lower lids, just the lower lid pouches, or just the upper lids. They want their creases to show and they think they have extra skin. Or they just want a mini cheek lift, or they just want a neck lift alone. Oftentimes, for the healthy person who does not have hypertension or diabetes or heart problems, etc., those procedures can be done right in the office under local or a block anesthetic with some oral sedation. For the right person, that can be economical, safe, and efficient. So again, we talked about non-invasive or minimally invasive cosmetic procedures. I'm a firm believer in my office that people deserve and need and want and get a custom designed approach. I think that's vital. I think you can go on the internet and read about this magic treatment and this quick magic lift, etc., and everybody gets in line and gets the same thing. I think what people deserve, particularly for facial rejuvenation, is a custom designed approach. Again, I'm Dr. David Morwood. I am a board-certified plastic surgeon. I have over 20 years experience in these types of procedures. This is Your Health television program. We're now going to take a very brief pause for a very good cause. Thanks so much for being here.